Senator Moody.
Honourable Senators, I rise to provide some concluding thoughts on Bill C-64. I want to thank my colleagues for their comments so far and the sponsor of the bill, Senator Pitt, for her hard work and dedication in shepherding this complex legislation through the Senate. I also like to acknowledge my colleagues in Social Affairs Committee for an excellent study of the bill and the many witnesses and Canadians who came to testify or who have shared their thoughts and concerns in other ways. I will be supporting this bill, and I urge you all to do the same. This bill has received a significant amount of attention because it begins to address an urgent need and evokes a sense of hope for many Canadians. They envisage a world where they have access to life-saving drugs they need in the same way that they have access to other life-saving necessary medical services. And they're eager to see this hope become a reality. I join in their eagerness. After all, Canada is the only OECD country with a universal healthcare program that does not include universal coverage for prescription drugs. I strongly believe that we ought to aspire to a system that is universal, single-payer, and publicly funded, often referred to as the Hoskins model. In this model, the government covers the cost of prescription drugs for all Canadians from the first dollar spent, a promise of no out-of-pocket costs, no deductibles, and no confusion over whether you are covered or not. Consistent with the values of our public Medicare system, this is a system that would provide access to comprehensive, evidence-based treatments for every Canadian, no matter who you are, where you live, how much money you make, or whether or not you have a job. With a Pharmacare system like this, Canadians would not have to choose between paying their rent, their groceries, or getting the drugs they need. Parents would not have to forego meals to ensure that their kids had vital drugs. Women would not have to remain in abusive relationships to be able to maintain access to insurance for themselves or for their children. Does Bill C-64 create such a system? Well, the short answer is no, it does not. It is not everything I or many Canadians want it to be. However, I firmly believe that it is a critical first step. Let me explain why. Universal pharmacare is past due and is vitally necessary. Therefore, any step towards providing a pharmacare program is an important step. The status quo leaves too many Canadians behind, forcing them to make difficult decisions that put their health and their lives at risk. Today, millions of Canadians either have inadequate prescription drug coverage or no coverage at all. For people with chronic conditions like diabetes, the cost of insulin and other life-sustaining treatments can lead to devastating choices. During committee testimony, we heard from the multiple witnesses about Canadians who were forced to choose between paying for their medications or for the basic needs of life. We heard from the Canadian Labour Congress, that 1 million Canadians are taking out loans to pay for their medication. C-64 covers diabetic drugs and contraceptives and related products. Without a doubt, many would wish for more. I would wish for more. But in covering these two classes of drugs, we are making a substantial difference in the lives of millions of Canadians and their families. For diabetes, the physical cost of not adhering to your prescription is dire. Experts in committee noted that 40% of all heart attacks in this country come from diabetes, 30% of all strokes. These are shocking numbers. They spoke to the risk of blindness, kidney failure, loss of limb, of complications that could be significantly reduced and avoided with established access to the right medications from early in the course of one's illness. When it comes to contraceptions, witnesses pointed out that 40% of pregnancies every year are not planned. we heard that many of those who are impacted by lack of access to contraceptives and other family planning tools are more likely to live in poverty, less likely to be employed full-time, and more likely to rely on public assistance. And for children, children are more likely to live in poverty and face developmental challenges. So, colleagues, the status quo is not working. This change is long overdue. This is why I accept a step-by-step approach, because any step in the right direction is better than standing still while Canadians suffer. Advocates and individuals, Canadians, are all calling for this bill to pass, as is and without delay. We have heard from unions, advocacy groups, and everyday Canadians, not only through committee testimony, but through letters, emails, and I'm sure many of you have received these communications. This is not just an abstract policy debate. This bill responds to the lived realities of millions of people in Canada who are depending on us to take action. This does not mean that passing Bill C-64 is the final step. It cannot be. Our work is not over. We must push to achieve the end goal, which is a universal, public, single-payer system, and we have a long way to go before we get there. Crucially, this bill takes action on a few key next steps. It calls for the Canadian Drug Agency to create an essential prescription drugs and related products within a year of royal assent. This will be a vital step towards the creation of a national formulary. A comprehensive, evidence-based list of prescription drugs and related products that Canadians would have access to in a national universal pharmacare system. And colleagues, this will require extensive engagement with provinces, territories, Indigenous communities, drug manufacturers, and with patients. Bill C-64 also calls for the CDA to develop a national bulk purchasing strategy for prescription drugs and, again, related products. An effective bulk purchasing strategy could lead to big savings when it comes to the cost of providing access to medication in Canada. In committee, we heard from Dr. Steve Morgan, who noted that there's a lot of buying power in being a single payer. He gave an example, comparing prices in Canada and New Zealand, which has a single-payer public pharmacare program. Looking at the top 32 generic drugs sold in Canada, he found that if we paid what New Zealand pays, we would save $770 million a year on just those 32 drugs. This first step towards a pharmacare system is important, but there is still a long road ahead, and there are several challenges. One of these challenges will be countering those who seek to send us down another path, some in the hopes of protecting their own financial interests, have erroneously argued that pharmacare would stunt access to new medicines in Canada. Well, colleagues, a patented Medicine Prices Review Board report found that 79% of drugs introduced between 2013 and 2022 provided slight to no improvement over existing drugs, but made up over 60% of revenue share. This highlights the caution that not all drugs provide good value for money or should be included in a pharmacare formulary. Rather, pharmacare means we'll be more likely to purchase drugs that have the highest value for the best cost. And should be noted that the list of drugs and related products covered is not really in this bill, which allows for future change in the list without legislative amendment. Similarly, we've heard concerns from some that this bill will negatively impact private insurance. Well, yes. Some have suggested that insurers will scale back their coverage on employers will choose to remove coverage for areas covered by Bill C-64. Others have called for constraints to ensure that insurance companies don't remove coverage of contraceptives and diabetes medications. Colleagues, it's important to note that the regulation of the market conduct of insurance companies is a provincial responsibility, not a federal one. Every province has a provincial act responsible for the regulation of insurance in their province. And so, I would say there are negotiations to be had at the provincial level and conversations to be had between employers and their employees, between unions and their members. This bill is an opportunity for them both. We heard from union representatives that this bill is an opportunity to negotiate for better coverage. If there are savings for employers due to the government covering these selected medications and products, this will give them the freedom of choice to expand coverage in other areas, leading to even further benefits for their employees. Let me be clear, private insurance is not the solution to the lack of access to drugs many Canadians face. Universal Pharmacare is. This bill is a beginning, not an end. It's a floor, not a ceiling. Provinces can improve on this and include other medications. While it may not be everything we hoped for immediately, it is a foundation upon which we can build. It is the first step toward a Canada where no one has to worry about whether they can afford their medications that will keep them healthy. As a physician who has seen far too many of my patients and their families struggle to maintain their health needs due to high drug costs, and as a woman who has seen the impact that access to reproductive choice in family planning can have on women's lives, I'm proud to see Canada make this important step. For that reason, colleagues, I urge you to join me in supporting Bill C-64. Thank you. Merci, Megrich.
Senator Batters, you have a question?
I do.
Would Senator Moody accept a question? Senator Batters.
Thank you very much. Some of us from Saskatchewan received a letter from the Saskatchewan Chamber of Commerce about this issue in Bill C-64 and their concerns with it. And a couple of the stats that they quote in it, they say that currently about 90% of mid to large size employers and about 70% of small businesses do offer prescription drug benefit packages to attract and retain employees. And then they also indicate in this letter that the recent estimates that they have put the number of uninsured at about 2.8% of Canada's population. So with those numbers that I've been provided from the Saskatchewan Chamber of Commerce in mind, one thing I'm wondering about is I heard the part in your speech where you were talking about the private drug plans and that would potentially be a matter for negotiation with provinces, etc. But what I'm wondering is, did you receive any information at committee? Sometimes people who are of lower income, they may have those drug plans, and maybe the main benefit they get out of those employer drug plans is coverage for these prescriptions that are being covered under Bill C-64. Did you hear any evidence about whether their premiums for those type of workplace drug plans would potentially be reduced, given that the government would be paying it, the federal government would be paying it under a single payer plan?
Senator Moody.
Thank you, Senator Batters. You know, in fact, we did not have true representation of small businesses at committee. We had chambers of commerce, but they really took the position of talking about, in my opinion, talking about primarily their clients who were insurance companies. In fact, some of my questions to them challenged them to say, what, in fact, is your position for small businesses? Because we have heard, many of us, and maybe yourself, have heard from small businesses that there are different ways they might approach this. There are new opportunities that this might present for them. So no significant data was provided in answer to your question, and in fact, To some disappointment from my perspective, the Chamber of Commerce representatives, witnesses, did not actually give us more of a perspective that was different from protecting insurance companies.